Okay, the thoracic spinal nerves is where we are now. So we did the cervical plexus, the brachial plexus, and now we're on the thoracic spinal nerves. Importantly, these don't form a plexus. Notice that they don't wad up like these or those or those. They just give rise to what we call the intercostal nerves. And so the intercostal nerves mostly go between the ribs, intercostal, and they innervate the intercostal muscles, the external and internal intercostal muscles. So that's their motor function. And then they also have sensory function from the anterior and lateral chest wall and also from the pleural cavity. So that's their sensory and motor function. And now we move down to the lumbar plexus. And the lumbar plexus, it's complicated, but you only learn 2 nerves out of it. So again, you should be able to recognize it. How do you recognize it? Process of elimination, no atlas, no axis, no ribs, right? No sacrum. So this is the lumbar plexus coming out L1 through L5. And when you look at it in a cadaver, it dives mostly anterior to the os coxa. And whereas the sacral plexus mostly dives posterior. So keep that in mind. It mostly goes anterior too. So if you look at the femoral nerve, you only learn 2 nerves out of it. The femoral nerve and the obturator nerve. The femoral nerve is easy to find because it runs right anterior down the thigh. And it does innervates most of the anterior, or 8 anterior thigh muscles. And then its sensory function is the anterior thigh and the medial thigh, also the medial leg. So let me show you its sensory locations. Yeah. So all the way down the middle, anterior thigh, and then all the way down the medial surface of the thigh and the leg. That's its sensory function. As far as the motor function, it is going to innervate most of the things that it goes by as it goes through there. So 8 anterior thigh muscles, anterior and some medial. The rectus and vastuses, the quadriceps group, rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis. The iliacus and the psoas major, because see, it starts up there by those. Iliacus and psoas major, so it starts up there by those. And the sartorius and the pectineus. So that's the 8 anterior thigh muscles. And then there's its sensory function right there. And then the obturator nerve, it's pretty easy to find too, because if it's going medial on the thigh, it's going to be the obturator nerve, just because that's the only one that you actually learn. Notice that the femoral nerve actually branches a ton, but you don't learn the individual branches. So the obturator nerve goes here and it goes medial. So anything medial that you didn't already take care of, and you know, some of these are a little bit more medial than others, like the vastus medialis, but the obturator nerve is mostly like your adductors and things that might help with adduction. So you've got adductor longus, brevis, magnus, and then the gracilis and the pectineus. Okay, you don't have to know the other ones. And then so it brings your legs together. So what your femoral nerve does is mostly knee extension and a little bit of hip flexion. And then your obturator nerve mostly does adduction at the hip, or adduction of the thigh. And then its sensory function is right there. So if somebody put their hand right there by your junk on the upper portion of your thigh, right there, you would feel that with your obturator nerve. Cool? Okay. And then next plexus, last plexus, is the sacral plexus. And how do you find sacral plexus? Well, it's got a sacrum on it, right? So what does the sacral plexus do? You've got a few muscles that you have to learn out of the sacral plexus. First off, when you find the sacral plexus, look at this picture. Notice one more time. So with this one, do you see how most of the nerves of the lumbar plexus go anterior to the os coxa? And these guys, so anterior to the os coxa, right there. But the sacral plexus nerves, do you see they mostly dive posterior to the os coxa? They're going to run down like the back of your thigh, all the way down your leg. You don't have to label them from this picture, just recognize the plexus. And then let's look at the nerves. Let's see. Okay, here's your sacral plexus running down the backside. Okay, so some nerves that you can find off of there. Do you see these two, the superior and inferior gluteal nerves? Those are going to do glute stuff. So the superior gluteal nerve does three gluteal region muscles. It does the TFL and the gluteus medius and the gluteus minimus. So it has no sensory function. So that's the superior gluteal nerve, and that's the ones that it does. And the superior gluteal nerve, if you were looking for it, the superior gluteal nerve is right here. Okay. The inferior gluteal nerve is the lower one of the two, not surprisingly. And it does one gluteal muscle, and it doesn't have any sensory function. So the gluteus maximus is innervated by that one, which is the same as that one right there. No sensory function. And then the sciatic nerve, look at this big honker right here. So we have the superior and inferior gluteal nerve, and then the sciatic nerve, which is so big. It is, the sciatic nerve is like this big honker that's running down the back of the gluteal region and then down the back of the thigh. You cannot miss it if you are looking. And the sciatic nerve itself will branch, and then the branches of the sciatic nerve are actually going to give rise to the innervation that we want to be talking about. So you're running down and seeing the sciatic nerve, and then watch. It's going to branch into the tibial nerve that goes down the back of the tibia, and then the common fibular nerve that's going to go lateral, right, because the tibia is medial and the fibula is lateral. And then the common fibular nerve will branch into the deep and superficial fibular nerves. So let's do the tibial nerve. So the tibial nerve, we are going to branch. It branches off of the sciatic nerve, and it gives rise to innervation for 4 of the posterior thigh muscles, 5 posterior leg muscles, also the plantar surface of the foot. And the sensory function from this, the tibial nerve, is the plantar surface of the foot and the heel. So I'll come back to that in just a second. So here's your tibial nerve, right? Tibial nerve goes by all of these muscles as it's going down the back of the thigh, and then it's going to go down all of those posterior leg muscles. So the biceps femoris long head, okay? The semimembranosus and semitendinosus and part of the adductor magnus, flexor digitorum longus, flexor hallucis longus, gastrocnemius, soleus, and tibialis posterior. So most of the back of the thigh and leg, not all of it. And then look at what it does as far as the sensory function. Plantar surface of the foot and the heel. Okay, so that's what it gives rise to, because this actually branches into all 3 of those. So all of those are from the tibial nerve. Okay, and then the common fibular nerve, right here, does one of the posterior thigh muscles that we didn't get yet. And that's the short head of the biceps femoris. Okay, took care of that one as it was going by. And then no sensory innervation. And then we go, common fibular is going to branch into the superficial and deep fibular. Yeah, superficial and deep fibular. And the deep fibular nerve is going to wrap around from the backside and go anterior. So it's going to do 3 anterior leg muscles. Tibialis anterior, extensor hallucis longus, and extensor digitorum longus. And its sensory function is so weird. It's the like flip-flops are irritating my toes area, right between your big toe, your hallux, and your second toe. It's going to, that's its sensory innervation. And then the superficial fibular nerve stays more lateral. The deep fibular nerve goes anterior and more medial, and the anterior surface of the leg. And the superficial fibular nerve stays more lateral. So it does the lateral leg muscles, the fibularis longus and the fibularis brevis. And its sensory function is it ends up on the anterior or dorsal surface of the foot. Okay? And then one last nerve. We never find this one on the cadaver, but it's so important that I'm just not going to leave it out. And that is this little booger right here. This little nerve right here, it comes out and then goes to your junk. That is the pudendal nerve that innervates the muscles of the perineum, the perineal area, your external sphincters. It also, that's its motor function. So like keeping your junk up in there, Kegel muscles, those kinds of things. And then the sensory function is the reason we have 7 billion people on the planet, because it innervates the external genitalia, including the penis and the clitoris. That's its sensory function. Is that little guy right there, okay, is the reason that you are here. Okay, and we'll do autonomic nervous system in the next video.